Hello, my name is Yan Yi. I'm from George Washington University, and I'd like to thank the sages for giving me the opportunity to present here. I have no disclosures to make. So about 110,000 ventral hernias are done every year in the USA. A quarter of those are done laparoscopically, and the number of those are increasing from year to year. So far, the literature shows that these laparoscopic repairs are associated with overall less complications, less readmissions, shorter length of stay, and lower overall cost. Meta-analysis of some prospective randomized controlled trials have shown that in addition to having overall comparable outcomes, the laparoscopic repair is associated with less wound-related complications. And we're looking specific, all the studies so far have been done on the general population. However, there's a subpopulation of patients with chronic liver disease in whose hernia are somewhat different in that, for example, the umbilical hernia prevalence is much higher in patients with cirrhosis, and cirrhotic patients have a worse outcome, higher recurrence rate, worse morbidity, mortality following ventral hernia repair. In these particularly risky patient population, they experience a better outcome if their hernias are done under an elective setting in comparison with an emergent setting. So that brings us to the question of this study is to see under an elective setting whether a laparoscopic approach would still provide the same advantages in clinical outcome to this particular population with chronic liver disease. So we picked patients from the NISQUID database from 2005 to 2013. We chose those with chronic liver disease by selecting those with a Mayo score of 9 or higher who underwent ventral hernia repair as their primary procedure during this time period. We excluded patients whose cases were done under an emergent setting, and we excluded patients who had conversions. Due to the baseline patient characteristic differences, we did a one-to-one propensity score matching before comparing their outcomes. The primary outcome of interest is perioperative mortality, and the secondary outcome of interest are wound-related complications, systemic complications, and length of stay. We also did a subgroup analysis of those patients whose liver disease are severe enough to cause ascites. Due to a small sample size for those group of patients, we use a multivariable logistic regression to adjust for other confunders. The results of our study show that during the study period, we have about 3,000 open repairs and 500 laparoscopic repairs. Their demographic distribution are similar, but the laparoscopic group is associated with less comorbidities, less severe hernias, less prevalence of ascites and varices, a higher baseline serum albumin level, and similar Mayo scores. So due to the baseline characteristic differences, we matched 500 of the open repair patients to 500 of the laparoscopic repair patients. And it showed that with the perioperative outcomes, the two groups have similar mortality, similar systematic complications, but the laparoscopic repair group still has a lower wound-related complication. Now, looking specifically at the group with ascites, we found that people with ascites, there's about 500 who underwent an open repair and 35 who underwent laparoscopic repair. The outcomes in this particular subcohort of patients is dramatically different from the overall group in that the laparoscopic group has a much higher perioperative mortality and more systematic complications, mainly from septic and renal complications and also a higher wound-related complication rate. So in conclusion, most chronic liver disease patients receive their ventral hernia in an open manner now. The subgroup that underwent laparoscopic repair tend to have a more favorable baseline health status. But despite the differences in their baseline health status, after adjusting for those, A laparoscopic repair is still associated with very comparable outcomes to an open repair and also provide less wound-related complications. And however, in patients whose liver disease is so severe that the patient has already developed ascites, a laparoscopic repair is associated with worse mortality and a higher complication rate than the open repair group. And that concludes my presentation.